The 2023 Australian Cerebral Palsy Register report has revealed the rates and severity of cerebral palsy in Australia continues to decline to the lowest in the world. For more on this, I'm joined by Nadia, Badawi, who is the Cerebral Palsy Alliance Chair of CP Research and Medical Director of the Gray Centre for Newborn Intensive Care at the Children's Hospital at Westmead. Nadia, thanks so much for your time this afternoon. Just how significant is this decrease, and do we know what exactly can be attributed to the drop in numbers?
But this is a phenomenal decrease, Christy. If you look back, say, 20 years, if we had 100 children develop cerebral palsy, now 40% of them will not have it. They will live a life free of disability, because cerebral palsy is the most common physical disability of childhood, and it lasts a lifetime. And it affects children in many ways, affects their ability to move, to live independently. And this is just a phenomenal result. And I think that there's many factors of it should really have the whole community interested, because not only are hundreds of Australian children now being born without cerebral palsy each year, but there's a big crossover between cerebral palsy and other neurological conditions. Many of us are going to develop neurological conditions in our lifetime. There's a big crossover between cerebral palsy and these conditions. So I think this is really an important result.
Absolutely. And it's not also just a drop in the numbers, but also a decrease in the severity of cerebral palsy that we're seeing.
I know, and this really excited me a lot. And we saw the beginnings of this result a few years ago, because I work in a newborn intensive care unit half the time, as well as working with Cerebral Palsy Alliance. And it's the second question every parent asks me: will my child survive? And then the second question is, what's their quality of life going to be like? And now in Australia, I can say that their child has a very high chance of survival. They have a very decreased risk of cerebral palsy, but should they develop cerebral palsy, it's going to be milder. So their child is more likely to be able to walk, they're more likely to have a normal intellect, less likely to have intellectual disability. But that doesn't mean we don't still have a very long way to go here. You know, I say that this is now the decade of the brain. And I've been thinking for a while that brain has really been shrouded in a lot of mystery. And I think we're going to start decoding some of those mysteries in this generation.
Yeah, let's hope so. And this data has been absolutely crucial to be seeing these results. How has all of this data been collected for this report?
Look, I think we're so lucky to have an amazing system like Medicare and NDIS, and the Australian Cerebral Palsy Register is another treasure, I would say. I know people get very bored when I talk about data and they think it's very mundane, but actually this measures what we do every day. It shows us the results, whether cerebral palsy is increasing or decreasing. So from it, this report, we know that better care of women going into preterm labor, better obstetric management, better care in our newborn intensive care units, public health messages like avoiding smoking in public, avoiding alcohol during pregnancy, that these initiatives are working. Also, it tells us the risk factors that can increase cerebral palsy, such as putting back more than one embryo during assisted reproductive technology. Things like this really make a big difference to the future. So we can plan for people with cerebral palsy and their families.
It is wonderful. And our rates, as I mentioned, they've dropped to the lowest in the world. Do you think that other countries now will be looking to Australia for their research?
Oh, absolutely, they are, because they envy the Australian Cerebral Palsy Register. It's the largest single country report in the world. They're also looking at how have we achieved these amazing results. So we want to help. And in fact, Cerebral Palsy Alliance has been supporting registers in low middle income countries like Nepal, Vietnam, also Ghana, among many other countries. But we also want to collaborate with other countries. We want to learn from them. That way, we'll accelerate the findings and find the answers so much more quickly than we could on our own. So an example of something that we're collaborating on internationally is the International Cerebral Palsy Genomics Consortium, because we've discovered with our collaborators that nearly 30 to 40% of cerebral palsy probably has a genetic association. And many of those genes are found in other conditions like autism, intellectual disability. We just can't do this on our own.
Absolutely. And just finally, I interviewed Bill Shorten the other day about an NDIS report which outlined some of the issues and at times abuse that people living in care homes were dealing with. Are there many people with cerebral palsy living in these group homes?
Look, it's actually devastating to read about these reports. And unfortunately, people who are vulnerable are always going to be the target of abuse. But this report has shown us we can't hide from this issue. And Cerebral Palsy Alliance is very committed to the support and dignity of people who live with cerebral palsy. And I think that we really need to listen, as we do, to people with cerebral palsy and their families. So I don't know if you know, Christy, but all of the research that we do has been guided by people with cerebral palsy and their families. And I also say that I think the NDIS is an opportunity for families and people with disability to choose accommodation that suits them. And we support those wishes. At CP Alliance, we have about, I think, 450 people who live in our homes, and just over a third of those have cerebral palsy. And we really wish to support their wishes if they wish to live with a loved one, with their family, with friends. I think this is such an important topic, Christy. It's really heartbreaking to hear about this.
Yeah, it absolutely is. We'll have to leave it there. Nadia, thank you so much for your time this afternoon. It's wonderful work that you're doing and wonderful to see these results.
Thank you so much.